My name is Dr. Ruby K. Kevala, and I'm a board-certified neurology-based chiropractor. I've been in private practice in Ventura County since 2000. I'm going to give you a brief overview of a revolutionary treatment for fibromyalgia that has had fantastic results for many, many fibromyalgia sufferers. If, after the next few moments, you realize how truly life-changing this information is, I've also made a much more in-depth DVD for you that explains more about the real causes of fibromyalgia and all parts of the case evaluation and treatment in detail. Just give our automated fibromyalgia hotline a call and I'll send it to you right away. Call 1-888-704-0276. Are you tired of running from doctor to doctor only to play Russian roulette with different medications? Here, try this drug. That didn't work. Try this one. It seems like they're coming out with a new fibromyalgia medication every month only to see it fail. Are you tired of taking drugs that don't fix the problem? Do you continue to struggle with constant pain and chronic fatigue day in and day out? I'm here to tell you that there is new hope. If you're tired of dealing with this problem and you're worried about it getting worse, pay close attention to learn how you can make a change. What makes me different from every other doctor that you've seen? Well, I treat you metabolically and neurologically. You're watching this video because you or someone you love is suffering from fibromyalgia. I'm here to tell you that no stone is left unturned to determine the cause of your fibromyalgia pain. I will guarantee that no one has ever told you what I'm about to tell you. I'm going to address, number one, what makes my program unique, and number two, how I successfully treat fibromyalgia. How do I successfully treat fibromyalgia? Simply by using specific metabolic and neurologic protocols. We do specific metabolic testing and treatments. First, we do sensitivity testing to determine if you have a sensitivity to gluten, which is found in wheat, rye, oats, and barley, or a sensitivity to milk, eggs, yeast, or soy. If you're sensitive to any of these food groups, it could be making your fibromyalgia worse, as it will increase inflammation in your brain and throughout your body. Some of the symptoms of these sensitivities are chronic pain or fatigue, frequent indigestion, bloating after eating, frequent loose bowel movements, constipation, mouth ulcers or sores, and frequent vomiting. The only way to find out if you are suffering from any of these sensitivities is to run the test. We also run complete blood panels. By using specific blood tests such as a thyroid panel, a complete metabolic panel, a lipid panel, a CBC, which is a complete blood count with autodifferential, we can assess your thyroid, adrenal glands, liver, kidneys, red and white blood cells, and gut function with all these tests. All can be affected with chronic health conditions. By addressing any problems with your thyroid, adrenal glands, blood chemistry, or gut function, we can help you to heal faster. The CMP also allows us to check your blood glucose levels, since glucose and oxygen are needed by the brain to function properly. We can also test the adrenal glands with a test called an adrenal stress index. This is a salivary test much like DNA testing. The adrenal glands sit right above the kidneys, and they are your stress organs, which mean that they react to stress. If the patient has been or are currently under stress, this test is an absolute must. The adrenals produce a hormone called cortisol, which plays a part in your blood sugar regulation, among other things. If you suffer from insomnia and/or diabetes, this test is a must. It will measure your cortisol levels. We look at immune panels, and this is extremely important. Your fibromyalgia could be caused by an autoimmune condition. Your immune system could be attacking your brain and your nervous system and other tissues in your body. This is why the immune panels are so important. There are two parts to your immune system, Th1 and Th2. We've got to get levels of immune cell messengers or cytokines to figure out which part of your immune system is in dominance. IL-2 and TNF-alpha are the Th1 cytokines that we measure. Th1 is T cells. T cells are the army that attacks and cleans up afterwards. Helper T cells, suppressor T cells, natural killer cells, regulatory T cells, and macrophages are part of the Th1 system. IL-4 and IL-10 are the Th2 cytokines that we measure. Th2 is B cells. B cells make the antibodies. They tell Th1 cells what to kill. If the testing comes back with a high B cell cytokine count, the patient is Th2 dominant. We also run T and B lymphocyte and natural killer cell panels. We analyze the big picture that all of these tests provide when looked at together. And then we must figure out if you have an immune pattern that we must, of course, address. I'll want to determine if there is an active antigen or immune dysregulation. Active antigens are parasites, bacteria, virus, mold, yeast, fungi, protozoans, foods, chemicals, and heavy metals. The best indicator for an active antigen as the cause of your abnormal dominance is the helper-suppressor ratio on T and B cell panel, also called the CD4 to CD8 ratio. The closer to 2.5 that ratio is, or above that, the more likely it is that we're dealing with an antigen. If the ratio is below 1.2, then we're most likely dealing with a dysregulation problem. We'll also need to check your intestinal permeability. This test is used to determine if the patient suffers from leaky gut syndrome. Leaky gut syndrome describes a condition of an altered or damaged bowel lining. Antibiotics, toxins, poor diet, parasites, or infection can all lead to increased permeability of the gut wall to toxins, microbes, undigested food, waste, or larger than normal macromolecules, and it has been proposed that these substances affect the body directly. Other people postulate an immune reaction to these substances. Whatever the case, if your gut barriers are compromised, molecules that shouldn't get through before they are broken down do get through, and your body will mistakenly recognize these molecules as foreign invaders. We'll also need to check hormone panels to determine if you suffer from low testosterone in males or low estrogen or progesterone levels in females. Symptoms related to decreased hormone levels could include depression, fatigue, mental fogginess, mood swings, hot flashes, sweating attacks, weight gain, and decreased physical stamina. Then, of course, we also need to perform specific neurological testing and treatment. Treatments such as oxygen therapy. Oxygen is fuel for your brain and nervous system. Your brain and nervous system need two things to survive: fuel and activation. Fuel comes in the form of oxygen and glucose. By using oxygen, we'll help you heal faster. By using exercise with oxygen therapy, or EWOT, we can increase firing to your brain. By simply increasing firing to your brain, we help many, many chronic conditions. We also use specific brain-based therapies such as vibration therapy. Vibration fires the back part of the brain called the cerebellum. One of the functions of the cerebellum is control of the spinal muscles. We may also use auditory, visual, olfactory, and caloric stimulation to increase firing of brain. Then we have non-surgical spinal decompression, or NSSD. NSSD creates a negative disc pressure and helps to remove pressure off of your nerves. It also provides a slow stretch to the muscles, which fires up the spinal cord and increases the firing to your brain. We may also use eye-lights therapy. Eye-lights are a fantastic way to specifically activate different parts of your brain and brainstem. Once we've run the necessary tests to determine your specific condition, we can successfully treat you via proper neurological and all-natural nutritional protocols. Ask yourself the following questions. How has your fibromyalgia affected your relationships, your finances, your family, or other activities? Number 2, what has it cost you in time, money, happiness, and sleep? Number 3, where do you picture yourself in the next 1 to 5 years if this problem is not taken care of soon? And number 4, what is it worth to you if we could improve your condition? I've made available to you a much more in-depth DVD that explains more about the real causes of fibromyalgia and all parts of case evaluation and treatment in detail. Just give our automated fibromyalgia hotline a call and I'll send it to you. 1-888-704-0276. That's 1-888-704-0276. Finally, please share this information with a family member or a friend. Thank you very much.